do a little performance of that. It was awesome. 747 Public Health and Social Services. Um, Annette Aguon, who is leading the vaccine logistics. I want to say, Annette. Good morning.
Honey, good
Planning.
morning.
Hi. How are you?
We're doing okay. How are you?
Long time. How's the family?
They're doing fine. Thank you. How's yours?
We're doing pretty good, Annette. Just missed you on the show. It's good to have you back. Um,
Thank you.
She's been busy.
I know exactly. And I know every time we try to get you on, they're like, "There's CDC meeting, table talk."
Our our time difference. It always ends up Guam calls or early morning, which conflicts. So
Right. Yeah.
yeah, it's all about trying to prepare us for the vaccines that are on the horizon.
Right. And there's so much preparation going on. I saw you got a little movie that came out there with the governor's office. Yeah, day. So maybe we could get an autograph later.
But Annette, this is actually what you do, right? You plan. You're head of like the vaccine department or whatever it is, whatever it's called over at Public Health.
Yes, my previous role was the immunization program supervisor,
Right.
and the immunization program is under the bureau I'm overseeing right now.
Right. And so this is a lot of the legwork in getting the vaccine out. Is it similar to the type of preparation you guys do for immunizations?
Yes, it's just at a higher scale. We have a lot of more federal partners who are assisting us with this. From the Department of Defense, the Operation Warp Speed, because all eyes are on the vaccine, and trying to definitely get closer to the end of this pandemic. Helping with bringing down the curve across the nation, in our island, and also globally. So yes, this is there's no antiviral really, like we had for H1N1 back in 2009. So this is something that, yes, everyone is anxiously been waiting for. But on the immunization side, we're always cautious. We always wait for CDC and the Advisory Committee on Immunization Practices to make that final schedule and recommendations. So, that's something that everyone I know is waiting for. But, even if the FDA approves the license for any of these vaccines, immunization programs and the health departments, we always wait for US CDC and the Advisory Committee on Immunization Practices, because they're our advisory board for the nation. And for Guam, we don't have one internally. So we look to them to give us the final recommendations on spacing, on age. Also, the biggest concern is, are there any medical contraindications? Because we never want to give a vaccine that may cause more harm. It's there to help protect and save lives. So definitely, like with any routine immunization, we always have to screen the individual. And so that's something that's at the core of immunization is, to protect and prevent disease, not to have any adverse events while you're getting the vaccination.
Right. So are you going to be taking the vaccine?
Yes, actually, for H1N1, I was the one of the first ones to get the flu mist.
Wow.
And our program had never carried the flu mist. And so, that's something that, we have to show confidence in. And again, that's why we always wait for CDC and the ACIP.
Right.
We look at the data and the research, because again, we do not want to do any harm. And we want to build that trust and confidence in people, especially that it's a new vaccine.
Right.
The process of getting it to Guam, us ordering it, distributing, is not new. It's just a more sensitive vaccine than we're normally used to, with it, the ultra cold. But that's just one vaccine,
Right.
So that's just what really is new, and even the technology for the vaccine. But other than that, everything else is pretty much what we would do for routine immunization,
Yeah.
be it child or adult.
Annette, what type of measures are being taken to protect these super mega deep freezes that we got from like power outages and that stuff?
Yes, we are definitely building in redundancy, and that was part of the reason why we showed that video to reassure the people of Guam that we are preparing. We have been taking steps. We've kind of been in the background and low key about it, but we do have 3 ultra low temp freezers. They're in 2 different locations. We are ensuring the backup generator is maintained and is being serviced. So they're working fine. We're also beefing up security just to make sure there's no issues in regards to if people find out where it's being stored. that there's any issues, because that's always a concern, the security of a very limited vaccine or any type of medication in light of a like an outbreak or a pandemic.
Right.
What about in the video? You also mentioned receiving some sort of a test shipment, the thermal shipper. I'm not sure what
Yes.
it was. Can you tell me more about that?
Because of the very sensitive nature of the Pfizer vaccine, this shipper was something that we've never had to use before. We've had other type of like thick insulated vaccine coolers that have come for other vaccines, but those were more in like reusable ice packs. It really is the chickenpox or the varicella vaccine that would come normally in dry ice before. So now that this is Pfizer's vaccine, it's very sensitive, to the heat. They wanted to make sure even the process of ordering it and shipping out to the different jurisdictions, especially the Pacific Islands, because we have our unique challenges. They wanted to see how is it going to come in. Are we receiving it at the place that we're indicating where it should be shipped to? Because this is considered a direct ship. So we order it through CDC. CDC tells Pfizer will ship it directly to the jurisdictions. And so that was a test run, while we're preparing again for the actual shipments to come in.
Okay, but there was nothing inside. It was just the
No, it was
container,
empty, but
yeah,
at least it gave us a real world, seeing how the actual container looks like. I thought it would be bigger actually. So
Yeah,
it was surprising when it came in. I'm like, that's it? We're used to too much. We're used to bigger boxes of vaccines
yeah.
that double the size. And so we saw this, oh, okay. But now we're dealing with dry ice and we have to make sure we're handling it properly. And it's very sensitive. When we open it up, we have 5 minutes. We got to put in dry ice and close it back. Again, that's how sensitive this vaccine is for Pfizer.
Arts, he spit out some numbers during that video, but he also prefaced it by saying, hey, it could change, right? So what are the numbers today in terms of the amount of vaccines we're going to be getting?
For today, the Pfizer vaccine, we definitely know 11,700, which is double what we had originally were told. Back in like early November, late October, early November, we were told 4,000 doses of Pfizer. Then a few weeks ago was 7,800 doses. And then now it's 11,700, which is good. We want to see our estimates going up. But people have to remember that's divided by 2 because it's 2 doses, 21 days apart. And so we're looking at, 5,800 individuals getting a 2-dose series just for Pfizer. And then we're waiting for Moderna, the vaccine B, as they call it. It's less sensitive. That one, projections, initially were first shipment will come in like 25,000, and then every 3 to 4 weeks you get another 25,000. But again, like Pfizer, numbers have changed. Delivery estimate dates have changed. Everyone was sharing before election, November 3rd. Then now it's late November, right before Thanksgiving, to now it's mid-December. So again, it's always a moving date, moving numbers, but they go based on population. And again, we want to reassure people, whatever is allocated to the respective jurisdictions, we will get to use it. We order it, based on how our demand is going, our usage is going. And especially with Guam being in Typhoon Alley, I always have to remind people, we don't want to order everything at one time because God forbid if we have a storm and we lose everything. I'd rather we have smaller, more frequent orders coming in. And also, what if the unit malfunctions, or again, if another surge is coming, we're going to have to shift over, making sure our nurses are dealing with the new cases, right? And so we always have to think that far along and try and balance, and just to make sure our supply chain is not interrupted and that we don't lose these vaccines because they're already limited to begin with.
Moderna, how many did you say?
They were estimating about 25,000 every like 3 to 4 weeks. And again, those numbers can change, especially when you're dealing with vaccine manufacturing. If there's something wrong with the batch, then we're not getting it. And so that can affect, the number of doses we get. And again, this is something that's being pretty much divvied up across the jurisdictions, so as the vaccine manufacturers are developing more, or producing more vaccines, they have to spread it out equally across all of the 64 jurisdictions. So it's the US APIs, we're talking about the Atlantic territories, and then the mainland states, Hawaii and Alaska. So again, over 300 some million, within the US. So that's something that they have to spread out evenly as much as possible. And so they kind of go pro rata based on our population.
And so the Pfizer is the first one to come, and then after Pfizer, we get Moderna. Is that
Yes, we're hearing about expect 1 to 2 weeks after Pfizer comes out, then Moderna will be available. And so that's why all eyes are on the FDA meetings and will they approve it?
yeah?
Because that's the first step. They need to approve it. And then once that's approved, we wait for CDC, and we're hoping that'll take a few more days turnaround. And normally this process for approving a vaccine can take months. But because of the urgency in the pandemic,
Right.
that's why they've been really reviewing information over the past few months as they get it from the vaccine manufacturers based on the different phases of their human trials, just so that they can monitor it. So it's something that CDC, the advisory committee, and FDA have been reviewing and monitoring for months. It's not something that, here today's your report and I need you to turn it around in a couple of days, your decision. No, it's something they've been monitoring over the course of the months as the vaccines were being developed, as well as they moved into testing phases.
How soon after is public health anticipating to provide the vaccines to the community in general? Because first you do the frontliners, which looks like what they're going to be given the Pfizer vaccine.
Yes.
And
so phase 1A, as they call it, is for the healthcare personnel who have like direct care or have direct exposure to infectious material. And so, yes, we are definitely looking at giving it, of course, to the two hospitals, GMH and GRMC, because they are critical. And then public health will be the ones responsible for what's called a closed point of dispensing, where we will immunize the other healthcare personnel who are frontline, as well as like our EMS, the GFD. And so they are the first group that will get it. And then as we order more vaccine and we pull up the next group, which is considered like essential workers or critical infrastructure, that would be public and private. So we're looking at transportation. We're looking at GPD as well. Anyone that has a higher risk due to their line of work, or what we would consider essential services that need to be maintained, for the society to function. Airport, port authority, we have to make sure all the goods are coming, right? And so that one will slowly pull up as well. We have to look at individuals who have high risk medical conditions. The biggest group too is like the MNUMCO, 65 and older. They are a priority group. Residents of the St. Dominic's are a priority group. They're actually our number one with the healthcare personnel. And so it's definitely, those are the priority. And then as we get more vaccines, we slowly start to open it up to other, essential workers, and then we bring in the general population as well. So it'll be like a rolling immunization campaign for several months, because again, it's also dictated by the number of doses that we are allotted.
You said phase 1A. How many phases are there, and is this something in writing that you could send to us so we can take a look at it and let the community know what exactly is this plan?
Well, the phases are phase 1, 2, and 3.
Okay.
Within phase 1, they have a 1A, which is again the healthcare workers with direct care or exposure to infectious materials. They have then also the long-term care residents would be considered 1A. And that was something that just recently came out from CDC, that they moved up the long-term care residents. 1B are considered the essential critical infrastructure workers, as well as the MNUMCO 65 and older, and the individuals with high risk medical conditions. Those kind of fall into like the 1C, right? And then phase 2 is basically immunizing those in phase 1 that we didn't immunize. We didn't get to immunize right on time. And again, there are some people who don't want to get it right away, and we respect that. And then we start to open it up to other essential workers, as well as the general population. And then phase 3 is where you anticipate there's more vaccines available, and then you continue on. Whoever didn't get in phase 1, who we didn't get in phase 2, we're going to reach you in phase 3.
Okay, so this is these phases are from the CDC. It's not necessarily a Guam.
No, but we again will follow national recommendations, and then we will refine it based on our local needs, because again, every jurisdiction's outbreak is different. which population is being impacted the most, be it by age, medical condition, or ethnicity. So we get to tweak it a little bit following national recommendations, and just kind of further sub-prioritizing if we need to because of the limited doses that we are expecting.
Okay. Should we anticipate some cute little PSA like a campaign for the vaccine?
Yes,
Is there like a title for this? You know how Adelie comes out with these cutesy little thingies that we see.
Pico
I'm
the
not
Carabao.
the creative one, but
You know what I
I'm
mean,
not the
though.
creative one, but yeah, we're working with the Governor's Communication Office as well as the Joint Information Center, and we have our internal team of health educators and the PIO and our education and community health outreach team. And so that they're collaborating and we are putting information together, and they'll come up probably with a nice caption or slogan.
You
and
remember
that-
with
yeah.
the mosquito fight the bite, you
Right
know?
on, yes.
We're going-
Yeah.
I mean, I'm not trying to toot anyone's horn, but one of the greatest jingle writers of all time is in this studio.
Oh,
so
boy.
if you wanted, our help,
Wear your mask.
don't hesitate. All right.
You know what I want to see? A big
From the guy who brought you Stay Home.
You know what I want to
Yeah,
see?
you're such a great writer.
I
You just
know,
have
it's
all
just-
the ideas.
Oh man.
You know what I think would be cool? You know what I think would be cool?
What would you think would be cool, Jay?
If you had like a syringe with a Sanahi and Vicente vaccine.
Oh damn. See, there you go.
Okay. Annette, was there anything else?
No, we just asked, again, I just got to go back. I'm so happy that we're seeing our positive numbers going down.
Yeah.
The number of hospitalizations are going down. And so, again, we thank everyone for their support and their patience. KOM, you guys have been pushing it out there. So we appreciate that, the ongoing support. Again, it's something that we'll be planning. We'll be updating the community. I know there's going to be a lot of concerns of, well, I'm essential and why not that person and so and so. But again, we're looking at having a diverse advisory committee within our island to have a discussion based on, again, on national recommendations, but to be as fair and equitable as we distribute out these limited doses that we will be putting out there. Why are we picking this group over another group? Or why are we sub-prioritizing within the group? And again, it's all because of available doses and who is at most risk, be it from your work status, your exposure level, or because of your medical condition. And then we will continue to put information out as we get it from like the CDC and ACIP, again, using reliable resources. So we thank everyone for their patience. And now we're really trying to shift towards protecting our community, our residents, preventing more COVID, but it will take several months. We anticipate all the way, hopefully until summer is what we're hearing right now is to get enough people immunized to, helpfully start,
So in the meantime,
climbing out of this pandemic.
Annette, I guess in closing, I mean, with these low numbers that we're seeing, the hospitalizations are dropping. What do you need the people of Guam to do in the meantime?
Please don't relax too much. Don't let down your guard. We're always concerned. Thanksgiving, our concern is, what were those gatherings that happened on Thanksgiving that we may not see for 1 to 2 weeks post Thanksgiving? Are we going to see another surge, right? And so again, please continue washing your hands, social distancing, wearing your mask. And that's something too that even as we start to roll out the vaccines, we still have to remind people we're not at a high enough level to protect the community that will allow you to say, hey, I don't need to, wear my mask anymore, or, now I can have gatherings. No, it's going to be a slow balance of getting more people immunized while we're still practicing, that 3 W's that they talk about until we get enough people immunized and that we can really, flatten that curve out and we can have a sense of normalcy down the road.
Annette, Dr. Cabrera even mentioned it. This weekend is the weekend to watch, right, with what the FDA does, and so if the FDA gives the EUA, the emergency use authorization for the Pfizer vaccine, how soon would we see that arrive to Guam? And then when it arrives on Guam, how soon will we see public health rolling out this vaccination program for the frontliners?
What we anticipate once the EUA is approved, that CDC plans to start rolling out the vaccines within like 24 to 48 hours, right, to the various jurisdictions. For Guam, it normally takes about 3 to 5 days to get here. even by air. However, even though FDA gave their EUA, we are waiting for the CDC and ACIP approval recommendations. They anticipate that will take a few days after the EUA is issued to be released to the public and to the health departments. Once we get that CDC and ACIP recommendation, then that's where we will start to push out our vaccines within days or the week. So depending on when it gets released, then we will start pushing out because again, we can't do anything until we get the CDC and ACIP recommendations.
ACIP, what does that stand for?
Advisory Committee on Immunization Practices.
Okay.
And they take care of all like your routine child, adolescent, and adult vaccines.
Right on.
Okay.
Thank you.
So
Annette.
again, at the end of the month is what we're looking at for actual arrival to Guam.
They're looking at mid to late December, but again, it's all the timing for FDA and CDC, ACIP.
And the shipping, right?
Yes.
Yeah. Okay, so then after it arrives on Guam, how soon after that will we see phase one and for the frontliners being implemented?
Once the vaccines are approved by CDC, ACIP, we anticipate pushing it out within days already.
Wow.
Because once we get that vaccine, we need to push it out to the hospitals as well as to the other healthcare personnel. So we will be standing up within days. So that's what we're kind of planning out too is, week one, anticipate if we stand up on this week, we're going to push out vaccines. And then, we have to look 4 weeks down the road. You're going to get dose number 2 because 21 days later, we need to call you back in. And so those are some of the internal planning that we have to iron out, that you're going to get it on day 1,
right.
21 days later, your group is getting dose number 2 because day 2 was another group. We got to get them on the next, so it's going to be a constant rolling of these groups getting vaccinated. We always have to make sure no one gets the vaccine sooner than they're supposed to, because that's also critical. Timing is very important. If you get it too early, then it's not valid. So we also have to look at that. But also, when you got your first dose, did you have any problems? Were there reactions? Because we are required by law to report that to CDC. But also, I'm sorry, you're not going to get the second dose because, again, do no harm. We want to help protect you. We don't want to have the risk outweigh the benefits of getting the vaccine.
So do we have to wait for the frontliners to take the first and second dose before it's offered to the community?
No, and that's what we're planning out, because as we're hearing, Moderna comes 1 to 2 weeks later.
Yeah.
We're going to slowly keep pulling more people up. But again, it depends on how many doses is released to Guam. So as we get more vaccine, we're targeting the high risk groups, be it by your job or by your medical condition or age. And then as we get more vaccines, then we can pull up more individuals. And the most important thing too is, what did CDC recommend? Because right now we're hearing there's no one less than 12 years of age that the vaccine is being licensed for. So even though we know less than 12, is CDC going to come out and say no one less than 18 or no one, so there's certain things we still have to wait for CDC. If you have an allergic reaction to a certain medicine or food product, you can't get this vaccine. Even if you want it, I'm sorry, you can't get it. So there'll be screening being done every time a person's getting the vaccine, as we do with routine immunizations. So you may be a critical infrastructure person, healthcare personnel, but if you have a medical condition or an allergy that contradicts you to get this vaccine, unfortunately, you won't be able to get it. But that's why then we have to really push to have everyone else around you who can get it to be immunized, because now you're creating that bubble around the people who can't get it, be it by age, medical condition, allergic reaction. So those are other factors that we always have to put in, be it for routine immunizations or for this new COVID vaccine.
And then just before you go, because we're way late on the top of the hour, I had a caller. Will the vaccine be free?
It is free. It's from the federal government to the jurisdictions. We are not paying for anything, and so you will not be charged for the cost of the vaccine. Yes.
Okay.
It is free.
Thank you, Annette.
All right. Thank you.
Good seeing you. Be safe, okay?
Be safe too, and Merry Christmas.
Merry
Yes.
Christmas.
Happy Hanukkah.
Happy Hanukkah.
Okay. Yes.
Well,
Wow.
information overload today.
Vicente vaccine. Jay, that was
because you had
that was gold, bro.
you had stay home.
Yeah.
We've also had wipes up, car score down.
Yeah.
Vicente vaccine. I mean, it could if it works.